teachers get paid leave for COVID-19 that's not counted against their sick time? 217-629-7970. Want to hear from you on this Martin Luther King Jr. Day at 8:12. And again, the question being something in front of Governor J.B. Pritzker that's widely expected to be vetoed. And what exactly does this bill do? Well, it would allow for teachers and school staff across the state to take paid leave time for anything COVID related. So, for instance, if they get a COVID-19 vaccine, they get some time off for that. If they have a family member that they were in close contact with that has COVID-19, they could get time off. If they themselves contract COVID-19, they take time off. And the way the legislation ultimately passed, both chambers, with supermajorities supporting it, and the measure would allow for those leave days to not count against sick time, but instead count against administrative time. And some school administrators a little worried about what ultimately this would mean for schools. So when we covered this, and this is House Bill 2778, it passed in the fall, and it passed with veto-proof majorities. And it's reported, even when it was going through the legislature, that Governor J.B. Pritzker opposed this measure, and seeming to side with some of the school administrators that had serious concerns. This could lead to more school cancellations, especially after the year or so we've had significant learning loss among the Illinois students all across the state. So I want to hear from you. Is this something that you think the governor should sign, or should he veto this? 217-629-7970 is the phone number. Again, 217-629-7970. That's how you can chime in live and local here. Now, when we covered this several months ago, because it has been several months since it passed, and it's been on the governor's desk now for nearly 60 days. Has yet to be the full 60 days, and I think that mark is actually like January 28th or so. And the governor has a couple of different options. He can either do nothing and the bill becomes law. He could sign it and the bill becomes law, or he could veto it and send it back to the originating chamber, where, again, it had veto-proof majorities. But Pam Agnes, she's legislative director with South Cooperative Organization for Public Education. She told a committee that the measure, it could further compound staffing shortages that they're already experiencing in their districts.
We fear that one of the unintended consequences would be more closures and a reverting back to remote learning.
You also had Allison Maley with the Illinois Principals Association saying the unfunded mandate's going to further burden principals across the state by having them fill the classroom with the lack of staff that may be available. And a lot of times, principals are the ones that maybe substitute teachers if they can't find subs.
Without a limit on administrative leave days or a sunset for this provision to expire, we are really concerned about how this will affect staffing and providing a quality education to our students.
So I want to hear from you, 217-629-7970. That's the phone number here at 8:15. Good morning. You're on WMAY. Should teachers get this leave as administrative leave, or should it count towards their sick leave? Good morning. Hey. Oh, hold on a second. I got to turn up the right channel here. Start over. Go ahead.
Okay. I said this is actually a tough one for me, because my wife and my daughters are teachers, and one of my son-in-law is a teacher also. But I think that teachers are subjected more in the classroom to the possibility of getting COVID than, say, I would. Because even though I work around people, we always have a mask, there's distancing. It's different than being in a classroom where, say, you have 700 kids in a school, like where my wife teaches. So I think in the long and short of it, I'm sort of for it, but I can also see where it would be the possibility to be abused by a small minority of people, and that small minority, unfortunately, will be the ones that are talked about.
Well, and the teachers' unions adamantly supporting this. It did pass with veto-proof majorities, and if the governor vetoes it, then the legislature, they could take it back up and override his veto. So do you think that the governor should just go ahead and let this become law, or do you think that we need to see this play out in the legislative process of overriding a veto?
I think that it would be better to let it play out in the legislative process, especially in an election year, because that's going to tell you something about your legislators, which they didn't necessarily have to find out in a non-election year.
So yeah, there might be some electoral politics here, and how that impacts the governor, who has support broadly from teachers' unions, except for this issue. Apparently, the teachers' unions are pushing for this, but the governor has indicated, even as it was passing out of the legislature, that he did not support this idea, and apparently sending a letter to the teachers' union president saying he was going to veto this measure. So this could be a pretty significant battle hitting the state legislature. Appreciate the call on that. 217-629-7970 is the phone number. What do you think? Should teacher leave, if it's related to COVID, be administrative leave and not counting against the teachers or staff's sick time? And this is where I think might rub some the wrong way in thinking that if it's related to COVID-19, then it's sick time instead of administrative leave, which offers up the possibility it could be somewhat open-ended. And as you heard that caller there indicating, hey, this could be open for potential abuse. It could be something that even just one person may be able to abuse, and then it kind of snowballs from there. But at the same time, you've also got to consider, if there's going to be CDC guidance in place, keeping people away, even if they're a close contact of a possible COVID case, then should that teacher have to have their sick time taken away from them for calling out sick because of COVID? So it's interesting to see both sides of this, but where's that happy medium? Where's that area of, how is this going to be proven out? Are teachers just able to say, hey, I'm out, I was near somebody COVID-19 positive? Are they going to have to provide documentation of that? Are they going to have to offer up any kind of doctor's note, for instance? And then you get into some interesting questions as well about health privacy and, where do we draw the line of telling, our employers about what we've got and what we don't have when it comes to a sickness or an illness, or, if you're asymptomatic and you get COVID-19. How does that play into all of this? 217-629-7970. Again, this bill is on the governor's desk. He could veto it. I want to hear from you. Should teacher sick leave for COVID-19 reasons be for administrative leave, or should it count against their sick days? Good morning.
Doesn't it have to be bargained as to which one it is?
That's Tim, you're raising something that's kind of fascinating about all this COVID stuff. Has any of this been collectively bargained?
Yeah, I mean,
and also the impact on a local district, right? Because it's not just a statewide collective bargaining contract. These contracts are collectively bargained on a local level with all of these different local unions.
I know locally here we're going to do it for the people who work for the city, and basically District 186 is the city. I would allow it.
It's a different governing body altogether. And city employment, and in particular, the issue about the city of Springfield is if you got the vaccine, then you could have COVID leave time. If you didn't get the vaccine, you couldn't.
I'm saying the way it's working here in Springfield, I know they're different entities, but I say, look, if you've got COVID and need time off, then if you want to make it administrative and not personal, that's up to them. They can have one or the other, because it's not really going to make a difference on pay, is it? It's just how it's categorized.
But then again, if you get into a prolonged situation, a prolonged health situation, and I appreciate the call, Tim. We'll get more of your calls at 217-629-7970. But if you get into a prolonged health situation, there are other avenues that you can tap into. What is that? The Family Medical Leave Act? That allows for extended leave time. And instead, should that be something that's part of this? Should the family medical leave provisions be what's in place if somebody has to be out for an extended period of time because of COVID-19? So there are avenues out there. There are policies out there that allow people to take extended absence, be it for a family member that's, diagnosed with cancer, or they themselves are diagnosed with cancer, or whatever the area of health concern may be. So, I mean, that avenue's there. But this law that's on the governor's desk would essentially allow for teachers and school staff to take administrative time rather than sick time if it's COVID related. Should the governor veto this? 217-629-7970. We'll see what happens with this, because it's just a handful of days here, I believe, before the actual drop dead date of the bill. The governor has to veto it if he doesn't want it, or he can sign it or just do nothing and it becomes law. So this will definitely be something we follow up on. Appreciate everybody's thoughts on this. 217-629-7970 is the number if you ever want to chime in live and local. All right, now 8:22.